Yes, I'm here. Sorry about that.
Oh, no, it's totally okay. I was just thinking maybe we could just start with some waiver questions and get those out of the way, and then I can show them. And I have the waiver ready to put up on the screen.
That's
that we
great.
could show.
Super.
Okay, great. So we actually have one question to start with, and it is in specifically towards the language on the waiver application that says financial support for instructors for student learning hubs and space on campus to host learning hubs for equity. What do you have in mind, and what would a learning hub be limited? Would a learning hub be limited to TK through 6?
So if I get the question, it's asking a little bit about what the plan is for learning hubs that it's being worked on as we speak. And what currently are teams being able to set up learning hubs that are going to serve communities that are most underserved and have families that are the most challenged to do distance learning for a myriad of reasons. And we have had great luck in the last week in having sites identified. So there would, for example, we will be starting with sites in Central San Rafael, in the canal area of San Rafael, and in Novato. And these would be, and much of the detail is yet to be worked on, but the sites would basically be allowing a complete social distancing, masked, safe experience for students to come in small learning hub communities and be provided with support as they do their distance learning with their teachers. And so there would be staff that would be school-based staff or paraprofessionals who would assist the students. And the model that we're looking at is also having parents from the community who are able to work in support and with supervision and some of the other logistics related to the hubs. So literally this plan is being worked on. It's in response to the private pods that are being established in a lot of areas of Marin. And so that's kind of what we know right now. Probably looking at 2 sessions a day, an AM and a PM, based on the demand and the numbers that we're seeing that would be interested in the hub. And so that's what we know at this point.
Okay, let's see. Do we have any more questions? If not, what I can do is actually share my screen and we can go through the waiver application and just kind of look at all the boxes and information that you need to fill in. And should any questions come up, and then we would we'll go ahead and answer those. Okay, here we go. So here is the updated application process. You can find this on our website. I just put the link in there so you can find all of this great information and documents, not only this and the application, but the site-specific plan as well. And it is in, and we'll walk through that in a moment, but there's 3 different versions of different applications that you can use in order to fill that out. So hopefully yes, there's something that's accessible for you and your task force and your team as you're setting up all of these protocols. So as you can see here, it just links back here to more information about the governor's announcement on the 17th. And then it also has kind of 6 indicators that they're looking for, and you can find that in these bullet points right here. One of those is the site-specific plan. I can say that Dr. Willis is really looking for a lot of detail in these explanations for each of the 30 guidelines. So for example, instead of just saying, yes, we have protocols set in place, he really wants to understand what your protocols are and how you're implementing them and how you're communicating to your staff, students, and family as far as the health and safety protocols are concerned. There's a little bit of information down here about testing as well. I don't know, Ken, would you like to speak to testing a little bit?
The testing that we're seeing, I guess the biggest news that we're seeing in testing right now is that public health is make available for our public schools testing availability on a expedited use of the color testing lab that is currently working at the Marin Civic Center. And we are getting more information on that, but we have been able to provide that link to our staff, and I believe that that information is going to be going out. So the testing for private schools is being handled differently, and the plans for private schools, they need to be showing that they have a testing plan in place for their staff. The requirements for the testing are delineated, and if there's any questions about that, we can talk about those as well.
Okay, great, thank you. So 3 things that I want to point out really quickly. Here we have the primary and secondary points of contact. We will have a training, probably 2, one the week of the 24th, and then hopefully another one the week afterwards, so that we can get everybody trained on protocols and how to contact public health and kind of what they're looking for as far as information, so that they can conduct contact tracing should there be a positive case in the school. The next thing here is also, you're going to need to add a 50-word overview. So that's kind of in addition to all of the boxes that are on the site-specific plan, as well as you're going to have to kind of talk a little bit about your triggers for switching to distance learning. So should there be a situation where you need to close a school, how quickly can you kind of switch over to distance learning, so that, you know, there's not a huge gap in between that time and getting kind of the learning going back on. Here we have a timeline. So basically what we're going to be doing is reviewing with public health. Well, public health is going to be reviewing them and making the determination. But so what we will do is all of the applications that are received up until 5 o'clock on Wednesdays would then be reviewed the next Friday. And you can see here from that Friday over the next 2 weeks, it kind of explains kind of what those windows would be, and then what your expected start date would be, or your permissible start date. The next page goes on into the actual application. This is a fillable form in Adobe. So you can just put all of your info in here, proposed start date, what type of school you are. It does ask for your testing vendor if applicable. You can put your 500-word overview in here. Should it not be able to fit, feel free to just use a Word document, and you can attach it to the back so that we get your entire statement. You'll also have to talk about your consultation with labor, including dates, and then also with your parent and community organizations. There's also a box here for equity priority, and you can read here about kind of what we're looking for. Let's see. And just quickly, somebody asked if there's a list of testing vendors available in the county. If you actually go to the public health website, they have a list of vendors already with contact information. So you can look on the public health site. I'll try to track down the exact link for you guys in a moment. So this is your information that you're going to put in here about equity. And then this is just kind of a statement, just that you've done all the work, and this is your certification, and sign off. And again, this has, again, the timeline on here. So it's not too extensive. The real, you know, the grunt of the work is actually in the site-specific plan. So as soon as let's see, I'm going to pop right over here really quickly, and we'll go through the site-specific plan really fast. I know we've gotten a lot of kind of feedback on our old form, and it was a little bit finicky. So we fixed all of that. The actual site-specific plan is a lot shorter than it was. It no longer has all of those cleaning boxes that were kind of on those last pages. Instead, what we're going to be doing is it's all 30 guidelines, and there's a box for each 30 guidelines. And Dr. Willis and Dr. Santora wants to see an explanation about how you're implementing all 30 of the guidelines. So there's a lot of stuff that can be actually copied and pasted from the former form over, so you're not doing too much double work. I did want to show here that in all of the contact information for the site-specific plan, we do ask for your task force members and their positions, so that we can see that you kind of have looked over all of the kind of stakeholder groups and make sure that everybody is being involved. Both of your public health liaisons will be right here as well. And then again, it's just, you know, an easy box and a check box that you check off saying that you've done it. Again, if you have a lot of information that you want in each box, and and you just can't fit it in there, feel free to just add a supplementary paper at the back. You can use Word or whatever works for you to attach it to the back, because we want to make sure that we get all of the great information for all the planning that you guys have been doing over the past couple of months. So as you can see, it's just the 30 guidelines with a little box at the end. I did want to show you this right here. Marin Recovers asks that the business plans, the entire business plans, are taped to the outside window of each business. But as we know, this is a 10, 11, 12 page document. So it can get a little bit to be a lot. So what we're asking is if you could just maybe fill out this certification, put just this certificate on your window with the information on where it can be viewed to the public, so that your families, your staff, anybody in the public can view all of the protocols that you guys have set in place. So those are those two main documents. I'm just going to stop sharing now so that we can kind of see some faces and maybe, oh, thanks for putting that link in, Ken.
Sure.
Okay, so do we have any additional questions about the waiver process or the site-specific plan?
Yes, would you mind if I ask verbally as opposed to in chat?
Of
Not at
course,
all.
go ahead.
Okay, great. I'm Daniel Ezel with Kronos Academy in San Anselmo. And I thank you guys so much for fielding these questions and putting this out there. It's a lot of effort on your part, and it's really appreciated. I certainly do appreciate you. I do see that you put out the testing information website. Thanks, Ken. It doesn't seem to say how to garner a relationship with a vendor such that you would put it in that line item. It just has a list of places to get tested. Is it appropriate just to, and we're a private school, actually a very small private school. My wife and I run the whole program, especially this year. We've had other teachers, but we're not hiring anybody this year, and we're just keeping it really small. We'd like to, either do testing through, if we need to just apply for a test over the next week or two and go to any one of the ones that's available, that's fine. But what about, in the situation where we need to have a vendor, a relationship with a vendor? How do we garner that? Create that.
Are you talking about doing testing, a relationship with a vendor to test your staff, you and your wife and all of the students, or what were you thinking?
Yeah, possibly students, whatever is required and useful. So I'm looking at the hold on just a second, sorry.
Right.
I'm looking at that line where it's that line item where it says testing vendor if applicable and testing vendor phone.
Right.
That sounds like it's a little bit more of an official relationship.
Yeah, there are some vendors, Daniel. How about if we connect with you directly offline and we can share some information with you? It would be, I believe it would be for testing of you and your wife, who are the staff. And then if there were a need to begin to testing students because there's a positive, say, or a close contact, then public health would actually be engaged with that and would lead the guidance on how you would go about the testing of a student in that case. Okay, but we'll be in touch. Anything else? Anybody?
I have about two more questions. If it's useful for me to do this way, it's fine. If we need a dialogue via email, that's all the better for me. It doesn't matter.
Well, we're welcome. We would love to hear the questions, Daniel. You do have a unique situation. So maybe it is better if we just talk directly offline, but with some of your questions, because that there might be some different information we would give given the nature of your school. Okay.
Thanks for that. I appreciate it.
So just put your contact information in the chat line, if you don't mind, to me. You can do it right to me, and we'll make sure. I'm sure we have it as well, Daniel, but just in case, and then we'll be back to you.
Okay. Thank you.
Okay, well, if there are no other questions, then we'll be back again tomorrow at 10, same place. And if you are more into your document at that point and there's things that we can help you with, given that you will likely be putting some work into it between now and then, we're happy to do that. So we will be here tomorrow morning. Melina, thank you very much for leading our efforts here, and we will see you soon.
Yeah. And remember, rapid response at marinschools.org if you need anything.
That's right. Rapid response at marinschools.org. Thank you. Bye-bye.
Bye. Thank you. Daniel, will you send me your email address?
Yeah, I'll do that now.
Perfect. Thanks.
Is there a number I could call?
We don't really have a number. We use the rapid response that goes to all of our task force. I can give you my direct line though.
Well, whatever's most effective for the team.
Yeah, let's see. Signature because I never remember it.
Okay, great. When's a good time to talk?
Let's see here. So we've got back to school today. So we've got a lot of like Zoom calls and everything. So maybe like would after 3 be okay?
After 3 is just fine. Thank you. Let me post my number as well. Great. That'll be super helpful. Thank you so much.
Yeah, no problem. Yeah, just give me a call whenever and after 3 would be best, and then we'll get you all your answers.
I really appreciate you. Thank you.
No problem.
All right. Talk to you soon.
Okay, I'm going to shut this down now, okay?
Not a problem. Thank you.
Bye. Have a good day.